All right, so today we're diving deep into the world of arthritis.
Specifically, the
Yeah.
connection between arthritis and orthotic management.
We've got a stack of research
Oh,
here
yeah.
that really digs into rheumatoid arthritis, or RA as most people know it.
Right.
We're going to go way beyond just the surface level stuff today
Absolutely.
and really get into some of the more intriguing theories
Yeah.
about what causes RA and what's actually happening inside those joints.
Yeah, the thing about rheumatoid arthritis is that it's an autoimmune disease,
Right.
which means your body is basically attacking itself.
Yeah, your own immune system is going haywire.
Exactly. It's attacking your joints, leading to all that pain and inflammation.
And to really understand the impact of RA, we need to talk about the two main types, adult RA and juvenile RA.
Oh, absolutely.
For this deep dive, we'll mainly be focusing on adult RA,
Okay.
but we'll definitely touch on juvenile RA or JRA as well.
Good point, because JRA has its own unique characteristics and treatment considerations.
Yeah, it's not just a miniature version of adult RA.
No, not at all.
All right, so let's start with adult RA.
Yeah.
What's the latest on what actually causes this autoimmune response to begin with?
Well, the truth is, the exact cause of RA is still a bit of a mystery.
Really?
Yeah, there's no single gene or environmental factor that's been definitively identified as the culprit.
Huh. Interesting.
But there's a lot of really interesting research happening in this area.
Okay, so what's the inside scoop? What are the researchers looking at?
Well, one of the main areas of focus is genetics.
Ah, genetics.
Researchers have found certain genes that seem to increase a person's risk of developing RA.
So it's not like a guaranteed thing, though, right?
No, it's not a simple cause and effect relationship.
More like a predisposition.
Exactly. Having those genes doesn't mean you'll automatically get RA, but it might make you more susceptible.
Okay, so genetics might load the gun, so to speak.
I like that analogy.
But what actually pulls the trigger?
Well, that's the million-dollar question, isn't it?
Right.
And that's where other research comes in.
But
For instance, scientists are exploring the role of the microbiome.
the microbiome. I've heard a lot about that lately.
Yes, the trillions of bacteria that live in our gut.
Right.
And there's growing evidence that an imbalance in the gut microbiome could be a contributing factor in autoimmune diseases.
Wow, so our gut bacteria could be playing a role in triggering this immune system malfunction.
It's a fascinating theory. And if we can understand how those gut bacteria influence the immune system, we might be able to develop new ways to prevent or even treat RA.
Okay, so let's say the immune system has been triggered and RA is now in play.
Right.
What's happening inside the joints at that point?
Well, it's important to remember that RA is a systemic disease.
I mean,
It can affect the whole body.
oh, wow.
But the main battleground is the synovium.
The synovium.
Yeah, the lining of your joints.
Right.
And that's where you get that signature inflammation.
Got it. So the immune system is basically attacking the synovium.
Exactly.
Right.
It mistakenly identifies the synovium as a threat and sends in inflammatory cells to attack it.
So it's like friendly fire, basically.
Yes, and this causes the synovium to thicken and become inflamed.
And that's what leads to the swelling.
Exactly. The inflamed synovium starts producing excess fluid and the joint swells up.
Like it's being flooded from the inside.
Perfect analogy.
Okay, so what happens next?
As this inflammation continues, it can lead to the formation of something called pannus.
Pannus?
Yeah.
What is that?
Pannus is abnormal tissue that forms as that inflamed synovium grows and spreads.
Okay, so it's not just inflammation now. It's like this rogue tissue invading the joint.
Right, and pannus is a real troublemaker.
How so?
Well, it releases enzymes that can actually erode the cartilage in the joint.
Cartilage.
Yeah, the smooth tissue that cushions the ends of your bones.
Right, of course.
And as the cartilage breaks down, you start to get bone-on-bone friction.
Ouch. I can only imagine how painful that must be.
It can be incredibly painful and debilitating.
And the cartilage doesn't grow back, does it?
Unfortunately, no. Once it's gone, it's gone.
So this pannus is not just causing pain, it's literally destroying the joint.
Exactly. And if it's left untreated, the destruction can progress to the point where the bones in the joint fuse together.
Fused together.
It's called ankylosis.
Ankylosis, what does that mean for the person?
It means the joint becomes immobile, frozen in a fixed position.
That sounds awful.
It's the most extreme consequence of untreated ARA, and it can severely limit someone's ability to move and function.
So this is a really serious condition.
Absolutely, and that's why early diagnosis and treatment are so critical.
Right.
The goal is to control the inflammation,
Okay.
slow down the progression of the disease, and preserve as much joint function as possible.
So it's a multi-pronged attack.
Exactly. Medications can help dampen the immune response.
Okay.
Physical therapy can help maintain joint mobility and strength,
Right.
and in some cases, surgery might be needed to repair or replace damaged joints.
Got it. And you mentioned earlier that RA is symmetrical,
Right.
meaning it affects both sides of the body.
Exactly. So if one wrist is affected, the other one is likely to be affected as well.
Interesting. Are there any particular joints that tend to get hit first?
Well, RA often starts in the small joints of the hands and feet.
Those delicate little joints we use for so much?
Exactly. Things like buttoning a shirt or even just walking can become really difficult.
Right. I can see how that would impact daily life in a big way.
And as the disease progresses, it can spread to larger joints like the knees, elbows, hips, and shoulders.
So it's not just those small joints.
No, it can affect any joint.
Are there any early warning signs that might show up even before the joint pain starts?
That's a great question. And the answer is yes. There are often some subtle clues that can precede those more obvious joint symptoms.
Okay, like what should we be looking out for?
One of the most common early signs is fatigue.
Just feeling tired.
Not just ordinary tiredness, it's more of an overwhelming fatigue that doesn't go away with rest.
That's interesting.
It can make it really hard to get through the day. Even simple tasks can feel exhausting. And some people also experience weakness, especially in their muscles.
Muscle weakness.
Yeah, they might have trouble gripping things, or their hands might feel weak and clumsy.
And these symptoms can show up even before any joint pain.
Exactly. It can be a bit confusing because you wouldn't necessarily associate fatigue or weakness with a joint problem.
So it's like your body is sending out an SOS signal before the main event hits.
That's a great way to put it, and it's why it's so important to pay attention to these subtle cues and see a doctor if you're experiencing any unexplained fatigue weakness or other unusual symptoms.
Now, we've talked about how RA affects the joints.
Right.
But are there any long-term risks to a person's overall health beyond the joint damage?
Yes, unfortunately, because RA is a systemic inflammatory disease, the inflammation can affect other organs and systems in the body.
Meaning?
It can increase the risk of certain complications.
Like what kind of complications?
For example, people with RA have increased risk of cardiovascular disease.
Heart problems.
Yes, including heart attack and stroke.
Wow, so what seems like a localized joint problem can actually have widespread effects on the body.
Exactly. It highlights the fact that RA is a complex condition
Right.
that needs a comprehensive approach to management.
Addressing not just the joint symptoms, but the potential systemic effects as well.
Exactly.
Okay, we've covered a lot of ground on adult RA so far.
We have.
From those early warning signs to the potential long-term complications.
And it's clear that early diagnosis and intervention are crucial.
Absolutely. Before we move on to juvenile rheumatoid arthritis,
Okay.
is there anything else about the progression of adult RA that we should mention?
One important point to emphasize is that the course of RA can be quite variable.
Meaning?
It's not a linear progression where everyone experiences the same symptoms with the same severity.
So it's not a one-size-fits-all kind of disease?
No, not at all.
Interesting.
Some people have mild symptoms that come and go, while others have more aggressive disease activity with persistent pain and joint damage.
And I imagine that unpredictability can be really tough for people living with RA.
It absolutely can. It makes it hard to plan for the future, and it can take a toll on both physical and emotional well-being.
And what about statistically? What are we looking at in terms of long-term outcomes?
Well, here's a statistic that really highlights the seriousness of RA.
Okay.
About 10% of people with RA end up becoming permanently disabled because of the joint destruction.
Wow. That's a sobering thought.
It is. But the good news is that with early diagnosis and appropriate treatment,
Okay.
we can significantly improve outcomes for most people with RA.
So it's all about empowering people with the knowledge and tools they need to manage their condition.
Exactly. And that's what we're trying to do with this deep dive.
All right, so we've laid a good foundation on adult RA.
Yes, we have.
Now let's switch gears and explore the world of juvenile rheumatoid arthritis.
Excellent. JRA is often misunderstood.
Right.
So it's important to really shed light on its unique challenges and treatment approaches.
Absolutely. Let's delve into that next.
So when it comes to JRA,
Okay.
it's important to remember this isn't just like a mini version of adult RA.
Right. It's not just adult RA happening in kids.
Exactly. There are some key differences.
Okay, so let's unpack that. What are some of the things that set JRA apart from adult RA?
Well, for one, JRA can be much more systemic.
Systemic meaning?
It can affect the whole body, not just the joints.
Oh, wow. So we're not just talking about icky joints here.
No, you can see high fevers, rashes, swollen lymph nodes. Even the spleen and liver can be enlarged.
Whoa, that sounds a lot more intense than the localized joint problems we discussed with adult RA.
It definitely can be.
Hmm.
And this systemic involvement can make JRA trickier to diagnose,
Okay, I can see how that would be challenging.
especially in the early stages when it can mimic other childhood illnesses.
So if a child comes in with these kinds of symptoms, how do doctors figure out if it's JRA?
It often involves ruling out other potential causes.
A process of elimination.
Exactly. Blood tests can help by looking for markers of inflammation.
Yeah.
But sometimes it takes time and careful observation to see how the symptoms evolve.
So diagnosis is one hurdle, but what about treatment? Are the approaches for managing JRA similar to those used for adult RA?
There are some similarities, but there are also some important differences.
Like what?
Well, for example, the medications used to suppress the immune system in JRA might be different from those used in adults.
Makes sense. You have to tailor the treatment to the specific needs of a growing child.
Exactly.
Now, I know we touched on this briefly earlier,
Right.
but I want to circle back to the different types of JRA.
Okay.
Our research mentions three main categories.
Yes, there's pauciarticular onset JRA,
Okay.
polyarticular onset JRA,
Okay.
and then the most severe form, systemic JRA, which is also known as Still's disease.
Right. Let's break those down one by one. Starting with pauciarticular JRA, what are the key features of that type?
Okay, so pauciarticular means few joints.
Few joints. Okay.
And in this case, it means fewer than 5 joints are affected during the first 6 months of the disease.
Got it. So less than 5 joints involved.
Right. And it typically affects larger joints.
Larger joints.
Like the knees, ankles, elbows, hips.
Those weight-bearing joints.
Exactly, the ones that get a lot of wear and tear in active kids.
Yeah, that makes sense. What about the impact on a child's daily life? Even a few affected joints can be pretty limiting.
Absolutely. It can make it hard to walk, run, play, even just get dressed.
Yeah, I can see that.
But one interesting thing about this type of JRA is that it can sometimes lead to accelerated bone growth in the affected limb.
Accelerated bone growth, you mean like the bones grow faster?
Yes.
Right.
It seems counterintuitive, right?
Yeah, you'd think a joint disease would slow down growth, not speed it up.
Exactly. But it appears that the inflammation can actually stimulate the growth plates in the bones.
So one leg or arm might end up longer than the other.
Right. And that can create a limb length discrepancy.
Which can lead to all sorts of other problems.
Exactly. Gait abnormalities, back pain, hip issues, even difficulty with certain activities.
But can anything be done about that?
The good news is that with proper management, those discrepancies often resolve as the child grows.
So early intervention is key, not just to control the disease itself,
Right.
but also to address these potential complications.
Exactly. Now let's move on to polyarticular JRA.
Okay. How does that differ from the pauciarticular type?
Well, as the name suggests, polyarticular involves many joints,
Many joints, meaning
5 or more, right from the start.
significantly more than the pauciarticular type.
And it tends to affect a wider range of joints, including both large and small joints.
So knees and ankles, but also hands and wrists.
Yes, exactly.
Yeah.
And that can make things like writing or buttoning clothes difficult.
I imagine it can be incredibly challenging for a child to cope with that.
It is, and it often comes with other symptoms like low-grade fever, loss of appetite, and sometimes even a rash.
So it's not just the joints, it's a more systemic presentation.
Exactly. And here's another unique aspect of polyarticular JRA.
Okay.
It can affect the cervical vertebrae,
The cervical vertebrae.
the bones in the neck.
Oh, wow. So neck stiffness and limited movement on top of everything else.
Unfortunately, yes. It can make it hard to turn your head, look around, even participate in certain activities.
So early diagnosis and treatment are crucial here as well.
Absolutely. To prevent any long-term limitations in neck mobility.
It's clear that polyarticular JRA can have a huge impact on a child's life, both physically and emotionally.
It really can. And that brings us to the most severe form of JRA.
Systemic JRA, also known as Still's disease.
That's right.
Yeah.
And this is where we see that really pronounced systemic involvement.
Right. Those high fevers, the rash.
Exactly. Think high spiking fevers often reaching 103 degrees or higher,
Wow.
and a distinctive rash that comes and goes with the fever.
Okay.
And the inflammation can extend beyond the joints to affect other organs.
So it's not just a musculoskeletal issue anymore?
No, with systemic JRA, you can see involvement of the heart, lungs, liver, even the lining around the organs.
So it becomes a much more serious condition.
It does, and it requires very careful monitoring and management.
It sounds like treatment is not just about easing joint pain, but also about addressing those organ-related complications.
Exactly. And the course of systemic JRA can be very unpredictable with periods of remission and then sudden flare-ups.
So it can be an emotional roller coaster for everyone involved.
Absolutely. Now that we've covered the 3 main types of JRA,
Okay.
Let's bring it back to our main topic, orthotic management.
Right. How do orthotics fit into the picture for kids with JRA?
That's a great question. Orthotics can play a really important role in managing JRA.
In what way?
They can help reduce pain, improve function, and support healthy growth and development.
So it's not just about treating the disease itself.
Yeah.
It's also about addressing the functional challenges that come with it.
Exactly. Think of it as a two-pronged approach.
Okay, I like that.
We're managing the disease process, but we're also optimizing the child's ability to move, play, and participate in daily life.
And how do orthotics actually achieve that?
Well, let's go back to pauciarticular JRA and those limb length discrepancies we talked about.
Okay.
Shoe lifts can be incredibly helpful for compensating for that difference in leg length.
Right, trying to even things out.
Exactly.
Yeah.
It helps improve gait and prevent further complications.
Makes sense. And these shoe lifts, are they like separate devices or
They can be seamlessly integrated into a child's regular shoes.
so they don't feel self-conscious or different?
Exactly. Now, for children with polyarticular JRA, where hand and wrist involvement is common,
Okay.
hand orthotics can be really helpful.
Like splints and braces.
Exactly. They provide support to the affected joints, reduce pain and inflammation, and improve grip strength.
So they're protecting the joints, but also allowing the child to use their hands more effectively.
Right. Imagine a child struggling to hold a pencil or grip a toy.
Yeah.
Hand orthotics can make those everyday activities much easier.
I can see how that would improve their quality of life.
Absolutely.
Yeah.
And even for children with systemic JRA.
Where the focus is on managing those more serious systemic issues.
Exactly. Even in those cases, orthotics can still play a supportive role.
How so?
Oh. Even if the primary concern is organ involvement, we can't forget about the joints. Orthotics can help minimize pain, maintain mobility, and prevent further joint damage.
So it's about addressing the whole child.
Exactly.
Yeah.
Recognizing that JRA is a complex condition that affects multiple systems.
And when it comes to orthotics for kids, are we talking about those bulky contraptions you sometimes see adults wearing?
Not at all. Orthotics for children are designed to be lightweight, comfortable, and even fun to wear.
Oh, that's good to hear.
We want them to blend in with the child's life, not make them feel restricted or self-conscious.
Right, because kids need to be able to be kids.
Exactly. And there are so many options available now. Orthotics are becoming increasingly customizable.
So you can really tailor them to each child's needs.
Exactly. It's about finding the right orthotic solution for the right child at the right time.
And that involves a team effort, right?
Absolutely. It's a collaboration between the child, the family, and the healthcare team.
Okay, so we've talked a lot about JRA from the different subtypes to the role of orthotics.
Wait,
Now let's bring it all back to our listener. What are some key takeaways they should remember from this discussion on JRA?
I think the biggest takeaway is that JRA is not just a miniature version of adult RA.
Right, it's its own distinct condition.
Exactly. It has its own unique challenges and requires a specialized approach to management.
And early diagnosis and intervention are crucial.
Absolutely. The earlier we can identify and address the issues, the better the chances of preventing long-term complications.
And orthotics can play a vital role in that process.
They can help manage pain, improve function, and support a child's overall well-being.
So it's about empowering kids with JRA to live full and active lives.
Exactly.
Yeah, that idea of personalized orthotics is really fascinating.
It is, isn't it?
It's like moving away from that one-size-fits-all approach
Right.
to something truly tailored to each person.
Exactly. And I think that's where the true power of orthotics lies.
In that individualization.
Yeah, not just providing generic support, but really addressing the specific challenges each person faces.
So understanding not just the disease, but the person living with it.
Precisely. And that requires a deep understanding of the science,
Okay.
but also the art of orthotics.
The art.
Yeah, you have to consider things like gait analysis,
Right.
range of motion,
Yeah.
muscle strength, activity levels, even footwear preferences.
Wow. So it's really like creating a fingerprint for each person's needs.
That's a great way to put it, and
Yeah.
it's what makes this field so exciting.
It's always evolving.
Absolutely. It's a constant process of innovation, pushing the boundaries to create solutions that really make a difference in people's lives.
Now, thinking back to everything we've discussed today,
Right?
one thing that keeps coming up is the role of inflammation in rheumatoid arthritis.
Oh, absolutely.
It seems like inflammation is at the root of so much of the pain and damage.
It is. It's the driving force behind RA.
It's like a fire that burns through the joints,
That's a great analogy.
causing all that pain, swelling, stiffness.
And eventually, irreversible damage.
And we talked about how that inflammation isn't always limited to the joint itself. It can spread to surrounding tissues.
Exactly like the tendons, ligaments, and muscles.
So it's not enough to just address the inflammation in the joint.
Oh,
We have to think about the surrounding tissues as well.
it's this ripple effect that makes RA so complex.
So it's a multifaceted problem that requires a multifaceted approach.
Exactly.
Medications can help control the inflammation systemically.
Right.
Physical therapy can target it locally.
Uh-huh.
And orthotics can provide support and reduce stress on those inflamed joints.
They act like a buffer, shielding those sensitive joints.
It's like giving the joints a much-needed break.
I like that, a chance to rest and recover.
And by doing that,
Yeah,
orthotics can help slow down the progression of the disease.
absolutely, and prevent further damage.
So they're not just passively supporting the joints.
No.
They're actively participating in the healing process.
Precisely. And as we learn more about RA and as orthotic technology continues to improve,
Yeah.
we can expect even more targeted and effective interventions in the future.
So as we wrap up this deep dive into the world of arthritis and orthotic management,
Okay.
what's one final thought you want to leave our listeners with?
Let me see. Well, how about this?
Okay.
Imagine a future where orthotics are not just reactive,
Okay.
but proactive,
Proactive meaning.
meaning they can anticipate and prevent problems before they even start.
So orthotics that can actually predict joint damage?
Exactly. It might sound like science fiction,
It does a little.
but the technology is already being developed.
Wow. So how would that work?
Well, think about orthotics with built-in sensors
Okay.
that can detect subtle changes in your gait,
Okay.
posture, or joint movement.
So it's like an early warning system for your joints.
That's a great way to think about it. And by catching those early signs,
Yeah.
we can intervene early and hopefully prevent those minor issues from becoming major problems.
That's amazing. It's a really exciting vision for the future of orthotics.
It is, and it's a future where orthotics can truly help people live their best lives.
Well said. It's been a fantastic journey exploring this topic with you today.
It has been.
To our listeners, thank you for joining us on this deep dive into the world of arthritis and orthotic management.
Thanks for listening, everyone.
We hope you found it informative and maybe even inspiring.
I hope so.
Remember, knowledge is power. The more you understand about arthritis, the better equipped you'll be to manage it effectively.
Absolutely.
And as always, stay curious,
Yes.
keep learning, keep exploring, and keep those joints healthy.
That's great advice.
Until next time.
Take care.